Hello, everyone. This is our presentation on hypoxic ischemic events and their physiological effects on the brain. So, first and foremost, we want to understand what hypoxia and ischemia mean. Hypoxia is a condition where there's reduced oxygen supply to the brain, and ischemia refers to a reduced blood flow, which limits both oxygen and glucose or nutrients to the brain. So, an overview of brain physiology. The brain relies heavily on oxygen and glucose as its main energy sources. Through aerobic respiration, the brain produces ATP, the energy currency of cells. ATP is critical for maintaining ion gradients, which support neuronal signaling and brain activity. Brain tissue is vulnerable because of its high metabolic demands and limited ability to store oxygen or glucose. Glucose is a critical energy source for both the adult and developing brain. With oxidative metabolism providing most of the energy needed for brain functions, increased neuronal activity raises energy demands, leading to metabolic and vascular adjustments to support enhanced brain function. Proper brain function relies on tightly regulated energy metabolism at various levels, from regions to individual synapses. The neurovascular unit concept highlights the intricate relationships between brain cells and cerebral blood vessels, including neurons, glial cells, and vascular cells. Neurons and astrocytes are central to brain energy metabolism, with neurons primarily using glycolysis and astrocytes relying on oxidative phosphorylation. So, the pathophysiology of hypoxia and ischemia. The initial energy failure in the brain leads to the malfunction of the ATP dependent sodium potassium pump, causing an accumulation of sodium and water inside of the cells, leading the cell to swell. This triggers a series of secondary intracellular events driven by glutamate and tumor necrosis factor alpha, which ultimately results in cell death through apoptosis and necropoptosis pathways. Um, Simple schematic outlining the pathophysiological responses following traumatic brain injury or TBI and the complex outburst of secondary impairments. Note that secondary injury processes of traumatic brain injury include blood brain barrier disruption, neuroinflammation, excitotoxicity, metabolic impairments, apoptosis, oxidative stress, ischemia, and others. Associated with BBB or blood-brain barrier impairment, microglial and astrocyte activation, leukocyte infiltration, and upregulation of pro-inflammatory cytokines are characteristic of the neuroinflammatory response of a traumatic brain injury. Some consequences of cellular injury. Traumatic brain injury can damage the blood brain barrier, a critical structure that protects the brain by allowing essential nutrients to pass through while blocking harmful substances. When the blood brain barrier is impaired after traumatic brain injury, it leads to neuron loss, disrupted brain function, and challenges in recovery. The initial injury from physical trauma causes primary damage, but secondary injury occurs later, worsening the effects. This secondary damage can result in swelling, inflammation, and cell death, often leading to long-term brain disorders such as epilepsy and cognitive impairments.
So, hypoxia and ischemia can have a number of clinical manifestations from different causes. One of the more common causes is going to be an ischemic stroke. So, that's what I focused on with the symptoms here. There is a good amount of overlap between symptoms for different causes. So, there are a number of different categories of symptoms, and some of these symptoms occur in the short term, so as the event is happening. Some of them are long term, so after the event has happened and been treated, these are persisting symptoms. So, first, cognitive impairments. In the short term, as the event is happening, you can have sudden confusion or sudden trouble speaking or understanding speech. This can be slurred speech or aphasia, which is like word salad. Long term, after the event has happened, there can be lasting difficulty with attention and executive functions. There can be memory loss or continued trouble speaking or using words. Motor deficits. So, in the short term, there's sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, which is generally contralateral to the side of the body, the side of the brain where the ischemic event is happening. You can also have sudden dizziness, loss of balance or coordination, or trouble walking. Long term effects after the event has happened and been treated include continued paralyzation or weakness, again, especially on one side of the body, swallowing problems, and continued numbness on usually on one side of the body. Severe outcomes include permanent brain damage, coma, and even death in severe cases without quick treatment. So we've included this infographic here that goes over some of the basic immediate symptoms that can let you know that you should see a medical professional about the possibility of stroke. So does one side of the face droop? Does one arm drift downward when both are raised? And is the speech slurred or strange with repeating a simple phrase? And an emphasis on the need for prompt medical intervention.
Greetings, everybody. This is Sofia Penarviso. I'll be talking about hypoxic ischemic diagnosis, standard assessment, and laboratory findings in this section. Uh, the diagnosis, it depends on multiple factors. It depends on how long the brain was without oxygen, the area of amount of damage in the brain, and also the severity. It depends on the severity of the brain damage. There are multiple expressions towards that. We have the developmental delays, intellectual disabilities, epilepsy, cerebral palsy, and heart problems, even cardiac arrest. The initial assessment for a hypoxic ischemic event, it is presented in different ways and assessed in different matters. When it comes to infants, we have the APGAR assessment, which is the appearance, pulse, grimace, activity, and respiration, and is performed every 5 minutes to every 10 minutes, and as convenience of the healthcare providers. And in adults, usually is the Cincinnati Pre-Hospital Stroke Scale, and I will go more in depth in future slides. When it comes to the imagery, we have the CAT scan. We are looking for two main signs. One of them is the reverse sign, that is the loss of differentiation between the gray and white matter. And also we have the white cerebellum sign, which is the increase of resonance in the cerebellum due to the increase of intracranial pressure. This is due to the lack of venous flow. The second set of imagery is the diffusion-weighted MRI. There are two signs that we're looking for here today. One is the restricted diffusions between the basal ganglia and the cerebellum space that actually is narrowing, and also the intensification of necrotic matter around the brain due to the maturation of proteins around the brain. This sign is actually demonstrated beyond 24 hours after the incident. There are multiple tools that healthcare professionals apply to identify brain damage. One is the Cincinnati Pre-Hospital Stroke Scale, which identifies spatial droop, arm drift, and speech disabilities. The second one is the National Institute of Health Stroke Scale, which goes more towards the sensory, motor, and coordination deficits. And the third one is the Mini Mental State Examination, which evaluates memory, attention, language, and visual skills. There are additional laboratory findings that will assess to identify the maturation of proteins. For blood biomarkers, we have S001B protein, neurofilament, brain-specific enolases, prostaglandin, lactase levels, cytokines, and for CSF, cerebrospinal fluid, it is about the same, but the main difference is the glial fibrillary acidic protein. And then this next section, we'll be talking about acute interventions, biomarkers, and genetic predispositions post-treatment care. Acute interventions for hypoxic ischemic events is reducing the patient's core temperature to 92.3 to 94.1 for 72 hours. This prevents further brain cell damage. In extreme cases, surgical intervention is necessary to reduce intracranial pressure. Supportive care, it is ventilation, maintaining high PPO2 of the patient to 98% or higher. This requires oxygen or probably mechanical assistance. And monitoring vital signs, of course. The causal mechanisms for hypoxic ischemic events usually happen in different ways due to ages and exposures. For newborns, we have complications due to birth.
So how does the brain recover? It's through neuroplasticity, which is the brain's ability to reorganize itself by forming new neural connections throughout life. As far as strokes go, it's very helpful because through functional plasticity, the brain shifts functions from damaged areas to undamaged areas after a stroke. So if one part of the brain is damaged in a stroke, the parts of the brain, that part of the brain, the functions that would occur in it are transferred to a new area. So, what does therapy to look like to treat people after a stroke? It's looking at hypothermia therapy, which works by reducing the temperature of a person to reduce the brain damage that happens from secondary processes that occur after the stroke. Hypothermia therapy is considered experimental still for stroke victims because it works through reduction in the metabolism. So all the processes that happen in the brain happen at a slower pace, meaning that the harmful processes will also not happen as often after a stroke. It also helps to reduce inflammation in the brain, which helps to reduce swelling and cranial pressure caused by and more permeable blood-brain barrier, which will let in more fluids because of the stroke. Um, as such, the hypothermia helps to reduce all these harmful processes before they happen, which is the secondary damages caused by a stroke. The issues with research right now for ischemic events is that in humans, it's hard to know when a stroke is going to happen, and also the people that are having strokes are usually not healthy individuals. They usually have a number of other complications that can make it harder to treat them. There's also differences in just the way that human bodies work compared to animals. And because animals in a controlled environment are very much easier to study, we know a lot more about what happens in their brains and their bodies compared to our own because we cannot test human